My paternal grandparents were from Valencia, Spain originally, and my grandmother had debilitating, crippling rheumatoid arthritis. I went with her to see this physician who was one of, actually at the time, one of two hand surgeons in New York. And I said to myself, boy, this is something I could really do. This is Dr. Alejandro Badia coming to you from the Iceberg of Success. Please join us for other stories of entrepreneurs and their struggles. My name is Dr. Alejandro Badia. I'm an orthopedic hand and upper limb surgeon. My company is called OrthoNow and is essentially an orthopedic walk-in center, a disruption for how traditional musculoskeletal care is delivered. The idea of OrthoNow came about really from frustration. As a hand surgeon, I realized that virtually every patient who came to see me had been somewhere before. And that place, whether it be the emergency room or a general urgent care center or the primary care doctor, really didn't do much for them because they don't have the expertise. And I realized that there needed to be a facility where a patient could just walk in and have their problem appropriately addressed. And if further diagnostics or even surgery is needed, that can be set up seamlessly, all using technology. The value proposition of OrthoNow is to really disrupt how orthopedic care is being delivered. Currently, patients may go to a variety of facilities and not be seen by somebody who actually understands their problem. So the idea is to give patients access to that and referral sources. And really that has not been done until now. There are orthopedic urgent care centers that were started by orthopedic groups, a variety of other people around the country, but there hasn't been a standardized model, particularly one that utilizes remote technology, mobile technology, to be able to reach patients and for the clinicians to communicate in being able to deliver the ideal care to that patient in need. As a child, I realized early on I wanted to be a physician, in fact, specifically a surgeon. Part of that comes from the fact that when I was 8 years old, I went to see a hand surgeon, ironically enough, in New York City with my grandmother. I was, as an immigrant from Cuba, my paternal grandparents were from Valencia, Spain originally, and my grandmother had debilitating, crippling rheumatoid arthritis. I went with her to see this physician who was one of, actually at the time, one of two hand surgeons in New York, and I said to myself, boy, this is something I could really do. So it's a little bit boring in that I kind of went through life knowing what I wanted to do, including going to college, specifically with that in mind. Now, when I was younger than that, I was interested always in science, whether it be zoology or even veterinary medicine, at one point archaeology, but it was early on that I realized I wanted to be a surgeon. And in high school, I read The Making of a Surgeon, which is a book written by a surgeon who also trained at Bellevue Hospital. And I read that when I was 11. And then again when I was 16, when I was about to apply to colleges. So really, this has been something that's been in the making a long time. So the world of entrepreneurship is something I stumbled upon. I think I realized many years ago that when there was a problem or an injustice or something, somehow I wanted to fix it. And honestly, I call myself a reluctant healthcare entrepreneur because it's not like most fields where you do something, you can make some changes, and you can be compensated for it. In healthcare, you're depending always on that third party. That third party is insurance. So even if your idea is phenomenal, if the insurance industry doesn't pay attention, it's an uphill battle. To be an entrepreneur, I think you have to be very stubborn and resilient, because we all hear the great stories of success, but it's that messy middle, as the book outlines, the business book. The messy middle is really all those years in between the very inspiring start of a company and when the company is finally successful or perhaps is sold. I can tell you I was close friends, and certainly my own sister, who remains my main confidant and my executive assistant, tried to dissuade me at some point, and because my practice of hand surgery was very successful. But I was very frustrated again about how patients often came to see me, and I thought the healthcare system really needs something better. So there's no question that people have tried to dissuade me, but I also think that happens in many fields, and if you don't stick to it, then how are we ever going to progress in society? So if I wrote an entrepreneurship manual, I think I would entitle it Glutton for Punishment. I think you have to be willing to take your licks. You have to be, of course, stubborn, as we mentioned, and really driven, and be able to face adversity. There's no question that's part of it. It's the process is certainly not as glamorous as the term entrepreneurship suggests. For someone who wants to undertake an entrepreneurial journey, I think you have to have a vision. And once you have that vision, you have to be able to visualize what the steps are, and have the end game in mind. You have to have what would be the success. And then all the steps to get there, you have to assemble. And that is certainly the most challenging part. So one thing is to be visionary. Many people are. The question is, are you willing to follow up on that? And I think the key thing is to surround yourselves with the right people. The three values, core values that an entrepreneur should have is, for one, be open-minded. Because you have to entertain a lot of different ideas. And if you are too narrow, that is going to put up more barriers, hurdles than you're already going to have. The second one is to be resilient. You have to be able to get yourself up when there's failure, because that's just part of the process. And then because of that, you have to be very driven and passionate. Really, those two terms come to mind, because you have to want your idea, your vision to succeed. And for that, you really need a drive. I've often been asked if I ever wanted to quit. I think every entrepreneur has had those times when there's bills to pay and challenges to face. In fact, there's been many times where I've come extremely close to that, particularly in my case where this is not even my primary role. I'm a surgeon, I'm a clinician, and I have what I would consider a very successful practice. But when you're doing this as almost that second job, there are times when I said to myself, why am I doing this? And that's where the resilience comes in. The advice I would give to myself back when I was starting is to make sure I'm surrounding myself with the right people. And unfortunately, that failed me. I would listen better to my hunches. There are many times when I thought, boy, this person just doesn't seem right. And because I was inexperienced in that area, I thought, well, this is normal to have that feeling. The reality, it isn't. You really should listen to your hunches, especially once you're a certain age and you have an experience level. You really got to listen to that inner voice. So OrthoNow today looks very different than it was just a few years ago. It is now a licensing model. The team is very small. We've contracted significantly with the idea that once we have capital, part of that will be done to grow the team. But certainly the offering to somebody who's interested in opening an OrthoNow or several in their area is really quite well developed, soup to nuts. So at this juncture in time, OrthoNow is really looking for the right strategic partner, or perhaps even a complete acquisition. I say a partner because with capital and more manpower, and a healthcare company with a extensive Rolodex, we really can amplify this business model. And I think I'd want to stay involved, perhaps as a chief medical officer or the visionary. But certainly we are at a point where, an inflection point, where we can, the sky's the limit with our growth. I would want to say to those listening who are thinking about starting their own business to reach deep inside and say, do you want to do something where you're essentially working for yourself and your family? and putting your skills and your energy into something that reaps rewards for you and for those around you, as opposed to working for somebody, which is not nothing wrong with that, but there are some of us who value the independence and the fact that you get rewarded for that hard work directly. But as I mentioned, you have to be resilient, you have to be stubborn, and there is a trade-off, and not everybody's willing to make that trade-off. So one might ask, are dreams worth fighting for? And the answer is unequivocally yes, because at the end of the day, when you look at yourself in the mirror, you have to know that you've done what you wanted to do, what you were passionate about, what you thought of, and that you at least gave it a try. And hopefully you can succeed at it. But in the end, it's all we have. Material things in life come and go, and at the end of your life, an epitaph that I once read is, or I should say an epitaph you would never see, is here lies Joe, wished he'd spent more time in the office. So you have to do things that give you a charge, whether it be in terms of your private life or your recreation, but also in terms of vocations and things that put food on the table. You have to decide if taking a risk and doing something that gives you satisfaction is worth fighting for. And that's a very personal decision. So 3 words that would define me specifically in terms of my entrepreneurship journey would probably first be passionate. I care very much about the patients who come to see me and what they went through to get to somebody like me. And I wanted to disrupt that. So that really defines the second word is caring, because I honestly care. I care about the patients, but I care about our community, about society, and about our economy, something we don't talk about enough. The inefficient delivery of orthopedic care costs the economy a huge amount of money. In fact, it's been estimated that the cost of injury alone to our society, including downstream effect of lost work productivity, lawsuits, all of that, comes out to almost $750 billion. And we don't talk about that enough, society. And this is something I've been bringing to legislators. In fact, I've developed a relationship with Senator Bill Cassidy, a physician who's been a senator from Louisiana, and he's introduced me to other legislators. So I do have some hope, and the main message to them is that I care. I honestly care. I'm doing this for that reason, because again, my primary job is being a hand surgeon. And the third thing, in order to accomplish that, is really drive. And that's something that I've had since I was a child, whether it be competitive swimming or at one point ballroom dancing. I even played rugby. All of those things, I mean, you have to have some drive. And I've tried to translate that into first surgical practice, but now the journey of the reluctant healthcare entrepreneur. So I'm Dr. Alejandro Badia, and I was trying to deliver my journey as an entrepreneur, and I suggest that you subscribe on YouTube to the Iceberg of Success, which will give you a glimpse of other entrepreneurs who've had similar challenges in different fields, and perhaps you'll glean something out of it. It'll inspire you, and please follow it on whatever social networks are available, and let's all learn.